Hello, everybody. Welcome back to our channel, The Pursuit of Academic Medicine. I'm Shane, the founder of The Pursuit of Academic Medicine, and I have the pleasure of interviewing Rhonda Dailey. And she is a full-time assistant professor on the research faculty track at the Department of Family Medicine and Public Health Sciences at Wayne State University School of Medicine in Detroit, Michigan. She is also the scientific director to the Office of Community Engaged Research, the Office of Vice President of Research at Wayne State University as well. Formerly trained in medicine, she has over 20 years experience in behavioral and health disparities research and expertise in the recruitment and retention of minority populations and the engagement of medical professionals and community stakeholders in research. Dr. Dailey's research interests include women's health, health equity and disparities related to chronic disease, particularly asthma and hypertension, patient attitudes and beliefs about health and healthcare quality. Through the Office of Community Engaged Research, she has spearheaded diversity and inclusion efforts to hold a dozen of implicit bias workshops within and outside WSU, Wayne State University, and has provided many talks on the understanding of how racism has contributed to the medical mistrust and challenges in the study recruitment and retention among African Americans. Dr. Dailey's research is supported by several grants, an NHLBI Investigator Discovery Supplement to develop her work within the RO1 clinical trial focused on increasing asthma medication adherence in young African American adults, and as a site PI of two ROI studies investigating how maternal and paternal biological and psychosocial factors mediated through biological pathways result in preterm birth outcomes for African American mothers. Additionally, she oversees two recently awarded research supplements examining African American women's experience with COVID-19 and the association of lifetime trauma with maternal morbidity. And her educational background is a BS at Jackson State University, which is a great HBCU. And she went to medical school at the Carver College of Medicine in Iowa. Again, Dr. Dailey, it is amazing having you on here.
And thank you for inviting me, Shane. I appreciate this, and I appreciate your efforts in forming this platform to talk about, for faculty members to talk about academic medicine and research in general.
Yes, let's get right into it. I want to ask you, what opportunities are available to faculty mentors in academic medicine, specifically within the specialty of family medicine?
So academic mentors, right?
Yes, sorry.
Okay, no problem. So opportunities for mentors, when you're talking about mentors, let me just flip that around, and you're talking about faculty members in family medicine. So a lot of our family medicine department in the Department of Family Medicine at Wayne State University, we are very high up there nationwide. I think number 7 as far as research, NIH funded research. And I believe we're now number 1 at the university when it comes to NIH dollars. So we're very highly involved with a lot of research. We have a lot of behavioral scientists that are on our team. A lot of them have been trained formally in psychology. We do have a few physician researchers who practice medicine as well as do research. And for me, my background is in medicine too. I'm an MD, but I do research full time, also in behavioral medicine. But a lot of the research that we do is clinical research, where we are actually engaging people, participants, whether it's in the clinic, whether it's in the community, whether it's in the hospital. So we do a lot of clinical research in my department.
That's amazing. And in terms of that clinical research, does it branch into community engagement as well? Can you explain upon that?
Absolutely. So I'm involved heavily in community engaged research through the Office of Community Engaged Research. And while there are many stages to involve the community, we like for the participants to participate in research at the very beginning. So this is what we call community engaged participatory research, where you have the community members and are involved with the implementation, well, actually making up of the research questions, and actually going through which questions they like, all the way to the end where there's dissemination of research. So we have a few faculty members that are also involved in the Office of Community Engaged Research, and they're currently working on projects that has involved training participants on how to even do or not conduct research in a way that faculty members do, but also give them the background of what research is about. We were talking about IRB training. We're talking about looking at questions. What do you want from your community? All the way down to how can we disseminate this to even our peers and our community, other community members, and how to put those in bite-sized pieces so that they will understand what the research is about. Because a lot of times research is lost. So it's all kept in these ivory towers. And a lot of times, especially in communities like Detroit, people have had the history of people coming in and doing their research and leaving, and they don't know exactly what happened. So we're trying to break that silo and have community members involved from the beginning to the end. So we, a few of us are actually involved in really engaging community members.
That is a beautiful statement about what you're trying to do to break that cycle. Because I know this has to be a very large department, but do you also work with other facilities in Wayne State to do your research? Can you expound upon what other aspects you engage with?
So we collaborate with a lot of departments. So the Office of Community Engaged Research was actually created by one of my mentors, who's Dr. Phil Levy, who is an emergency medicine physician, who's also the vice president, one of the assistant vice presidents of research at the university. And all of this he's housed at iBio, as well as the Office of Community Engaged Research, as well as some of our family medicine researchers. We're also at the Office of the iBio office. We also have an office located at Alexandrine and Woodward. And there's also a clinical office that's located in Rochester. So we're a clinical department as well as a research department. So yes, we do a lot of collaborations with other departments, not only emergency medicine, but we're talking about social work, we're talking about psychology, we're talking about pharmacology. We collaborate with a lot of other researchers, faculty researchers that are in other departments. So yes, this is how we expand our research. We have a team of also great statisticians, research assistants. So they make the entire team, and we do collaborative work within the department too.
That is beautiful, because I know many people in our audience are like, man, I love working as a team. I want to engage in so many different things. And I think you just gave them so much reassurance right there to be like, okay, cool. I can dip into a little bit of everything in my career and then specialize in something they really have interest in later. I think that's beautiful. Opportunity to act in medicine that isn't present in private practice, possibly. I don't know. We have to see. But now I want to transition into some more personal questions about your career path. So what are some short or long-term goals you have in your academic career?
So my goal is just like any other researcher is to be, fully independent, where, I have a big team and, and actually funded a lot of funding. So we seek funding every year, multiple times a year. Sometimes it's very competitive, and not all the times that you will get, the results that you want. So you have to keep trying for these research grants, whether they're national grants, but also foundation grants, internal grants, any type of grants that you can run across. You try to go for it, especially if it's something related to your field of study. So, it's encouraging to look, and I guess I'm taking from my own background experience with medicine and looking at patients. And then even at the time, I was thinking, wow, this research is taking so long. Like, why does it take so long to produce this one article? I do understand now why it takes so long. Because the research, you have to apply, and then you have to get the funding, and then set everything up, and then actually conduct the research, do the analysis, clean up the data, and then try to get it published. Not every time that you submit it to a publisher will it be accepted. So that's another 2-3 months you have to wait. So it's a long process, but I do understand it. And I think it's important to have people of color, especially involved in the research process, because again, recruiting um, a lot of minority members who have legitimate mistrust in the healthcare system and may even be hesitant to participate clinical trials or even behavioral research itself. It's good to see people that look like themselves, that can understand, that can, can explain to them, this is what the research is about, this is what it's going, there's no harm here, this is what you get, these are your incentives, this is how long it's going to take, this is how long it's going to take for us to put the research out. We want to share this data with you as well. So it's a long process, but it's rewarding.
Yes. And what skills have you gained thus far that you believe has made you a better researcher now?
Oh, gee. Um, I think the one thing I must say that I do, and I still do this, I don't like to use a lot of medical jargon.
Hmm.
I don't like to speak over people's head. I like to kind of keep it very simple. And it seems to me that has helped even when I was seeing patients at the time, when I was explaining some very, very detailed medical information to them. I tried to break it down as much as I could so that they can understand it. And I tried to follow that same vein in research too. When you're explaining things to participants, you have to really think about where they are. And a lot of times this research is new and it's foreign. And when they think about it, they're thinking about someone prodding and poking them, which is not the case at all. We just want you to take the survey. We just want to know what your attitudes and opinions are about this particular subject. So I guess the ability to kind of break things down to people. I had that, but also it was enhanced even during this research, because you have to think about, okay, how can we formulate this question so that everyone can understand it? How can we make it so that we're going to get the data that we need, we're going to get the answers that we want, but so that the participant can feel comfortable about answering this. So it's a lot of, you have to think about everything. You have to think about, okay, did we think about this? What about this? What if they're in this situation? Did we think about it this way? So it helps to know, and to add those things to it, because a lot of times people think about research, they think about this box, and it doesn't have to be a box at all. You think outside of the box, think about the participant that you want to be part of your research study. So,
Wow. So that shift the perspective from the high so medical professional you see you are to someone that's just a participant, like you're saying, with these patients, or even the grant reviewers, I want to add in there as well, because they got to understand your research as well. If they're going to fund it, I hope they will understand it, and breaking it down will go a long way in moving forward. And I think
yes,
it's amazing. I want to gain that skill. I want to learn how to break things down like that. So that encouraged me right there.
right.
But what other, do you do any education during your academic journey as well for students that want to engage in research as well in the future?
Well, right now I've had some students that has helped with the research projects, and that's the way not a formal thing, but a lot of it has been a lot of mentoring. I just had a student who now is in residency, and she was involved in our project, what we call the BIB study, which is the biosocial impact on Black birth study, and she was helping with medical record abstraction, which was perfect for her since she was in medical school already and needed that skill anyway, because it's so needed in residency, your ability to peruse through the medical records and to abstract some things that you need to take care of that patient. The same for research. We had extensive medical record abstraction form that needed someone who had some type of medical knowledge. And that was helpful to that person. We've had a bunch of medical students that were involved with recruiting participants in the past, as well as helping to analyze some of the data. We currently have some students that are involved in the study. And I must say, I'm the site PI to this study, but the principal investigators are in different states right now, but students come on board all the time needing, to help with the study, and as well as to even, be on co-author on some papers and for them to write. So we encourage them to do that. So yes, there's a lot of student involvement.
Mhm.
Not more so resident involvement. I know that it's just they have such a short amount of time to do everything. And research is such a long process. And people don't realize, like students will come and say, well, can I do research for just a couple of months? And it's hard to get them involved if they're only involved for a couple of months, because if they really are recruiting, they have to take all of the training for IRB. They have to then take training when it comes to just how to conduct our research, how to conduct our surveys. What are the steps you need to take? Um, the BIP study, we involved not only surveys, but actually collecting biological samples,
Wow.
blood and saliva. What to do then, how to take the saliva, how to take the blood samples, what is the proper technique to do it, when to take it back to the lab, how to store it in the freezer. So all of those things are needed. So it's very hard to get someone in and say, I just want to do it for a summer or a couple of months. No, we want you more long term so we can understand. So first of all, you can understand the process, and we have to train you. And it takes a couple of months for you to get the gist of everything. So
Wow, that's amazing, because that is, I think, key to what makes academic medicine, because of all that teaching, all these skills and techniques. So
right.
what skills do you think you possess that make you a great educator for these students and your mentees?
More so, again, just knowing where they're coming from. So, as a student, I was even involved in research when I was in undergrad, as well as when I was in medical school a little bit. So I understand their needs. Okay. They need that experience, but we also try to make it so even if they can't be on the project for long term, what can you do to help out? Okay. You can't if you can't help recruit, then let's help with this paper. Can you do a a um, a review of articles for us so that we can get this paper done, and you can be on the paper too? Or so the skills that I kind of, so I guess the best way to say this is that I've been in that boat before.
Mhm.
So what we try to do is just make it so that the student comes out with the best learning situation that they can, the best experience that they can with the short amount of time that they do have with us.
That's
So, and it's a multitude of things they can do. If they cannot do the actual recruitment, maybe you can help out even with the analysis part, cleaning up the surveys. We have a qualitative piece to one of our projects too, where the student, if they wanted to learn more skills about how to transcribe even audio recordings, and how to make it so that we can take that information and use it for a paper. And this is the same for another project also involved in with the asthma study. Again, students are involved with papers. Students have been involved with recruitment when they can stay on a little bit. And that's why it's important that we have research assistants. And these are staff that are fully, that are full time with our project, and that we know that they're going to stay on for a little bit. And, they have been the glue to the entire process. And I can't thank the research assistants enough about how hard they work and how passionate they are about what they do.
That's beautiful. So now that just fosters so many more questions, how would a student that's interested in research like you're doing, but aren't at this institution, find a mentor like yourself? What should they look for?
Well, if you are at an institution, it's easy to look and see what you're interested in by going to the department's research section. They may list all the researchers, and then I've gotten a lot of inquiries over the years of students that are interested in research, or want to do something for the summer, or want to do a project, a capstone project that they have to finish. We also house the the MPH students, the people that are seeking Masters of Public Health, that is housed in our department. And some of our department faculty members are also faculty members now to the newly formed undergraduate um, um, uh, the undergraduate piece of the public health part. So they can earn a BS in public health as well as a master's of public health, through, through our department. Sorry. Yeah. So I guess I think I answered your question. I hope I did.
A little bit. Then this other aspect of the question is, what skills should you possess as a mentor for your mentees then? Like you said, taking it from their perspective, but what else would you say that one should possess to be a good mentor? Because many of these students, if they go into this career, they're gonna be teaching people that come after them, and what should they possess? What should they grow in?
Yes. So the mentor actually has to have time to spend with the mentee, and
Hmm.
they really do have to have some time to spend because everyone is busy. In research, we're constantly busy. So it's not only applying for research grants, but also managing the projects that we have, and it's managing the people that we have. So things come up. Not all the time that research projects go, seamlessly at all.
Mhm.
There's IRB to consider. There's things that, oh, well, this participant looked like they were qualified, but now they're not. What to do about that? How to resolve this issue? One participant won't finish their survey. How to approach that person? What to do? So there's a lot that's going on. So that mentee will have to have enough time. Even the mentor will have to have enough time to even be a mentor to the mentee, and the mentor will have to be able to, I'll say, bring the student in and actually have something for them to do. So a list of things for the student to do, whether it's a student that's highly skilled or a student that doesn't have many skills, have a list of tasks that they can do to help out with your project. um, Another thing, you just have to be open with students. A lot of times students, they do have other things they have to do. They have other classes. They may be not be in the predicament that they need to be in order to do everything that a seasoned mentor can do. So the mentor needs to be flexible when it comes to time, and very patient with students too, because again, a lot of them don't have the skills for research, but it can be taught over a number of time, over some time. Yeah.
That's amazing. And as we conclude this interview, do you have any final comments or thoughts you want to share with our audience?
I would say, if you're interested in research and doing research, one of the key things you have to realize is that you have to have good mentors. And how do you select good mentors? You have to know what you're interested in. And then it's always the squeaky wheel that gets the grease, is so true in academic medicine. So it's going out to established researchers and forming these relationships. And they do understand that, um, you know, um, very unseasoned researchers are people that are new to research. They need those skills, they need to possess them. A lot of times they'll bring you into the fold, and let you know. And these are mentors that will put you on grants, especially if you have the skills. And this is what happened to me. And this is how you build your own research program. You can't think about having and an RO1 study is like a big study from the NIH, which is over like 5 years. Sometimes they can be multi-million-dollar grants, but you don't start off a research with an RO1 at all. You start with a lower type of grant and work your way up. And the way you work your way up is, you collaborate with mentors, other people that will allow you to be either a collaborator on a research project or even a co-investigator. And that way you can then progress to a principal investigator. So, yes.
Wow. But thank you for the gems you dropped today during our interview, Dr. Dailey. It has been amazing talking to you, and I think our audience took so much from our conversation right now. And you can find additional videos from the Pursuit of Academic Medicine on our YouTube channel. And again, thank you for joining us today.
Thank you for inviting me.